Shut up shop now, that's the message to Oranga Tamiriki from a prominent Māori leader. The chair of the Whānau Ora Commissioning Agency, Merepeka Raukawa-Tait, says Oranga Tamiriki has a toxic culture and has been riding roughshod over families, snatching babies without any consideration for the devastating intergenerational impacts. Her comments follow a damning report into an attempt to remove a 6-day-old baby from his 19-year-old mother in Hawke's Bay. The internal review that identified a litany of errors prompted a public apology from the boss of Oranga Tamiriki and immediate policy changes. Merepeka Raukawa-Tait says nothing good will ever come from Oranga Tamiriki and that the Crown should have nothing to do with the care of children.
I would prefer that we didn't have a State Department anywhere near, particularly Tamariki Māori. Māori have to accept that we will own our own issues, we will provide the solutions, we will look to the people who are in the communities right now, and I'm talking very much about the Māori service providers, Whānau Ora navigators and others who are in the community. They know the families, they're already easily identifiable, but we want early intervention and prevention. We want to strengthen and make those families strong. We know it can be done, but it's not going to be done by a government department pumping, as of this year, from the budget, another $1 billion to make them smarter at uplifting the children. No way, that should not be happening any longer.
So what do we do? Just close down Oranga Tamiriki?
Well, that would be a damn good start, I have to say. Why do we need a big organisation to try and take the state has never done a good job at caring for the children. So put that $1 billion that was allocated to them this year in the budget, put that into the families, into the organisations who don't have the money to do the breadth of the work that they should be doing, and they're doing very well with what they've got, but it's not adequate. Strengthen them, make sure that they can identify the homes that are safe, and in every whānau there is someone who will step up, but most of them don't have the financial resources to take on another 2 or 3 little ones into their home. So rather strengthen the families than to strengthen a government department. That sort of thing should never happen.
So do you seriously think it's possible to shut up Oranga Tamiriki and keep our children safe? Get rid of it altogether? I mean, when? Now?
Yes.
Right now?
I don't see why not. Well, first of all, there are another couple of reports to come out, reviews to come out. The one by the Commissioner for Children, the Human Rights Commission, and also the Ombudsman, Mr. Bouchier. So, and of course, we've got our own one, which is our Māori review as well, the Whānau Ora review. So we've got a number of reviews. All of them will be damning of the Oranga Tamiriki. I'm absolutely convinced of that. Certainly they will have some recommendations, but I would like to say shut it down. Shut it down, get rid of it, have a core policy advisory ministry advising the minister, but everything else, the delivery of the services, the supporting of the families, the supporting of the mothers, all of the supports that need to get in, they should not be delivered by a government agency. No way.
So you are conducting your own inquiry, and without preempting the outcome of that, you've given a clear indication there that you think the outcome's going to be negative. You've interviewed, over 1,000 whānau. What are the common themes coming through here? Are the cases like the ones that we have seen in this report, or are they worse?
They are worse in some instances, but what we have seen is really a total disregard for the fact that Māori can look after themselves if given the support to do so. We've got intergenerational uplifting of children, so there's families in 1, 2, 3 generations that have been uplifted. Now, you can't tell me that somewhere along the line resources couldn't have been applied to that family through accredited Māori provider, service provider, to be able to support that whānau to make the changes necessary. Otherwise, we're continually going to uplift Māori children and send them off to juvenile hall and into prison. We don't want to see that. The government says it's committed to making changes for Māori. If you are, then let Māori make the changes themselves. As hard as it might be for Māori to confront some brutal facts, and Lisa, there are some brutal facts that we have to confront, but the government won't confront those. Their only solution is get those kids out of there, separate the mothers from the children, and we know the lasting trauma that has, and the children never come back as adults back back to the whānau so that they know their place. And so these are hard conversations that must be had by iwi amongst themselves, but it needs to be had.
When you talk about hard conversations and brutal facts, what exactly are you talking about? Because you know there are going to be people out there listening to you, Merepeka, who say, if Māori can look after their kids, why aren't they looking after them? Why are they overrepresented in statistics relating to abuse and poor treatment? You know that that's what people will be asking.
Yes, I do know, but I have to say I have very little regard for those comments. First of all, what have those people ever done to assist Māori to be able to take their place in this country as full contributing citizens? What we have to understand is in New Zealand we've had piss poor policy over many years that has relegated Māori to the sideline. We have seen structural reform come to this country in the 1980s that absolutely had a devastating effect on many Māori families. And so, you know, what we have to look at is what has happened. There's been a chronology of events in recent times, not going way back into historical times, into recent times that have not supported and helped Māori families to get to the stage where they can contribute. And so we've seen all of this systemic racism and discrimination in our education system. I'm on a health board. I've been there for 9 years. I've just been re-elected for a 4th term. I can tell you, if you want to see discrimination, look to our health boards up and down this country. So all I'm just saying is that we have to support those families to know that there is another way that they can get through life, and it is with the support of the wider community, with knowing who they are, be proud of who they are, and knowing that they have a right to contribute in New Zealand society, that this is their country and they have a right to be able to take their place and be fully contributing members. It's going to be hard because of where they've been parked up for such a long time, and that's no longer acceptable.
Are you angry, Merepeka?
I'm very, very angry, Lisa. I've been in this space for such a long time. I've seen what has happened for Māori women's access to justice when they come through the court system, when they try to report domestic violence, family harm, rape, all of these things. I've seen them brushed to the side, our children brushed to the side. And we continue to talk about, oh, Māori, why don't you pull yourselves up by your bootstraps? It's no longer acceptable. We have to see what have they had to cope with over all of these years, and still the government department is saying, we know what's best for you. They do not. Least government is best for Māori. We don't go to them for anything really if we can help it. No one's going to pick up the phone and say, or pick up the mobile and ring Oranga Tamariki and say, listen, there's a child in danger, we need your support. Nobody does that. That is one of the most, I think it's the most distrusted government department in this country because of what it does to children, what it does to families. And if there is no trust there, there is no relationship there, and nothing good will come of it.
Can it be redeemed? Can that trust be built?
I don't think so. I do know that recently there have been some accords, a memorandum of understandings with a number of iwis in the country. I think the iwi think that that's the best that they can do. I think we can do a lot better by getting this organisation out of our hair and saying to Māori families, you identify, if there's an issue in your family, you identify one person that we know you respect, you trust, and you would have no hesitation in putting your children in the care of that person. Let's strengthen that person. Let's look to see what other needs there are in the family. I mean, sometimes it's housing, it's no income, somebody's inside, there's truancy, there's ill health, mental health. All of those things impact on a family's ability to cope. Unfortunately, sometimes the weak and the vulnerable in the families wear it. That's not acceptable. We want our children, and indeed everyone in the homes, to be safe and to be well. But we have to strengthen the families. I don't want to see any more money going in to make a government agency smarter at uplifting children, Māori or others.
So those iwi that are signing memorandums with Oranga Tamiriki, are they being Hoodwinked? I wouldn't say they're being, well, that was my expression, hoodwinked. I don't think so. I think they've entered into that in good faith and goodwill. But the only thing really is if there is going to be an uplift, they will be notified. Why don't they say no? We want to be right where, if there is any concern raised about one of our children in our rohe, we want to know. We want to act quickly. But the thing about it is, we should be there prior to the event. Most of the Māori uplifts in recent years, certainly a great percentage, have been of newborns.
Well, you don't just have a baby overnight. You've got 9 months to identify somebody in that whānau or extended whānau or the hapu or the iwi. You've got midwives who can inform you. You've got everybody who could, the immediate and extended family, who could be developing a very, very robust plan for moving forward from the time the baby is born to see it's going to be safe. But more importantly, helping the young mother and the father to say, hey, listen, there's some concerns that we have. We need to make sure this baby's coming into a safe home. So get your A into G, and we're going to help you to make sure the changes in the home have been made. And it's not that difficult.
Merepeka, that newsroom video expose, it showed that a number of the Oranga Tamiriki staff involved there, the frontline staff, they were Māori. Yet this agency failed to maintain the mana of the family, consult with the whānau and look at wider placements. Can you be Māori and operate within Oranga Tamiriki and be true to kaupapa Māori? Does Oranga Tamiriki allow that to happen?
That's a very good question, Lisa, and I don't think you can. And certainly not in the organisation that it was, and I believe there has been an attempt to change that, and I know there has. But when you've belonged, and those, the social workers that I saw there were of a certain age. They weren't young. They weren't newcomers to this area of work. So what has happened, I believe, is they've become institutionalised as well, in terms of they know the system, they can throw the book at you, they can read the regulations backwards and frontwards, but it doesn't help, and it's certainly not a kaupapa Māori way. I mean, if you were to come to Te Arawa or anywhere else and say this is how we're going to uplift a baby in your rohe, which has happened, I might add, then we don't want to see that happen. It's happened in the past, and it shouldn't be happening now. And this is what the minister and the CEO didn't want to see. And yet, 2 years down the track, that is still going on. That sort of behaviour has been institutionalised within those senior social workers, and for them to make a call like that and to be so disrespectful and distrustful of the family, the kaumātua and the midwives, I just think that was disgraceful behaviour. So, shame on them. Shame on them.
So what are you telling your Māori families in the way they should deal with Oranga Tamiriki?
Well, first of all, I say they should never be speaking to Oranga Tamiriki without any support. That's absolutely crucial. I mean, we wouldn't even know about this case had it not been for that brave family. And, you know, they've had to put themselves on the line in terms of people know now who they are, whether or not we pixate their faces or things like that. Everybody doesn't, certainly most people do know who they are. They were brave enough to say, bring your cameras in. This has happened once before. We don't want it to happen again. We would never have known that this was going on. And now, of course, it's opened up a can of worms, because what we know through the Māori families who before have never been asked to say what was the impact, how were you treated, and that's of course the focus of our inquiry, that we know that this is just merely the tip of the iceberg. So what we're saying to our Māori families is now record everything, take someone with you, and do not take this lying down. Get in touch with your Whānau Ora navigators, get in touch with somebody else that you know that can support you as well. In every DHB there is a Māori liaison person. Make sure that person is there. Make sure you bring your kaumātua on, you know, and take older people with you, although I have to say in the past they've been dismissed and pushed to the side as well. But, you know, I think we have to push back on this department absolutely in every way possible.
Whānau Ora Commissioning Chair Merepeka Raukawa-Tait.